Hello, everyone, and welcome to another episode of the Self Care Oasis podcast with your host, Samantha Gregory, the Self Care Alchemist, where I help women transform burnout into better boundaries, more balance, and shameless bliss. Today, as usual, I have a wonderful guest, Miss Dana Sherwin. She is here to share her perspective, her work with women, and specifically people who are have been a patient at one point in time or another, or may in the future be a patient, and how they can be advocates for themselves. So, welcome, Dana. Thank you so much for being here.
Oh, thank you, Samantha. I'm looking forward to our conversation.
Me too, because I've dealt with illness. I know most women who are listening have dealt with some type of illness, whether it's stress induced or childbirth. Whatever the reason, there is a reason to be an advocate or to actually know and have the tools and be equipped to manage when you are a patient. And the reason why I really love this topic is because self-devotion, self-care is the hallmark of what I talk about a lot. And sometimes you don't realize the correlation between being a self-devoted person and having autonomy, sovereignty, and power to be able to advocate for yourself in the medical space, in healthcare, because that's where a lot of people give away a lot of their power. I've saw it over and over again. And so I'm excited to have this conversation with you. But even before that, I want us to know more about who you are, what you do, how you are changing the world, and if you've ever dealt with some type of stress related illness, burnout, and just how you've managed that.
I've had a very long career in healthcare as a healthcare executive, as a consultant in many different kinds of healthcare settings. And even with all of that knowledge and all of that focus and loving my career and feeling like, was filled with so much purpose in helping
Mhm.
people access healthcare services, I found myself in a place that I wasn't taking care of myself.
Mhm.
And I really didn't know what it was like to be a patient, even being in the healthcare system for over
Mhm.
35 years. And I learned most of what I will share today and my messages and my platform and the information that I found on my own healthcare journey. I was diagnosed when I was in my 40s with a blood cancer disorder that was genetic in nature, not hereditary, but genetic. There were no tests at the time to determine what it was, but I felt I was experiencing different symptoms. But because I
Mhm.
had a big career and two children and a home, and I was doing life and being productive doing life, I just pushed those symptoms aside. They weren't so bad. And so that was one thing that I did wrong and didn't really
Mhm.
research anything. And the other thing that I really did wrong was I didn't have a dedicated primary care physician. I was using my obstetrician gynecologist and seeing
Mhm.
that person on a yearly basis instead of seeing a primary care doctor to be able to enable me to have a baseline blood test was, to really get a really good check on my
Mhm.
body and what my body was going through. And so it was quite a shock to me when I really was starting to feel ill, and one of my doctors suggested, I've done the blood test, your blood counts are a little high. I'm going to send you for a sonogram to see what's
Mhm.
going on because I was complaining of pains in my stomach. And
Mhm.
so the blood test was the first indication. And then I went for the sonogram and they sent me on an emergency basis for a CAT scan. And I said, what's going on? We want to make sure we think you might have a blood clot. And it turned out I had a blood clot in the portal vein of my liver that was starting
Mhm.
to get big enough and block the blood flow.
Mhm.
So when I was leaving the CAT scan, I got a call from my doctor who had ordered these tests. It turned out he was a gastroenterologist because I had a pain in my stomach. So I went to a
Mhm.
gastroenterologist, and the doctor asked me, "Do you have a hematologist?" And I said, "Why would I have a hematologist?" He says, "Well, I think you have a blood disorder." And I didn't even understand what that all meant. And he said, "I need you to go right to the emergency room because you have a blood clot and it's probably due to an underlying blood disorder." And I was in the emergency room and then was admitted into the hospital for about a 4-day period where they diagnosed me with a blood, it's actually a myeloproliferative neoplasm. You have too much blood in your system. I had too much blood. And that's why I had this blood clot, because my bone marrow was producing too many red, white, and platelets. This is considered a blood cancer. So I was fortunate that it was caught in time. The blood clot was caught in time. I was able to see a hematologist regularly and really start a process and this whole healthcare journey that became more complicated over time. Initially, I was able to be just monitored and having blood tests because the bottom line for this disease and the progression of this disease, there was no cure but for a stem cell transplant. And
Mm,
this was over 20 years ago. There wasn't really a lot of information online on the internet. The research that had been done was very old. And in fact, the research showed that people who had my disease had 11 more years to live. And I had teenage children and I was in my 40s. So 11 years really didn't seem that much. But
mm,
my doctors assured me that those studies were done a while ago. And if I was monitored, they'll monitor me and we'll take it one step at a time. I would say about 8 years ago, I was able to live really a normal, productive life. I got a primary care physician. I was seen by a hematologist. I had other things checked out. Then my condition morphed into having too little blood in my system because of this disease, this genetic
mm,
deformity in my genetic makeup. My bone marrow wasn't producing enough. And when your bone marrow dries up and you don't have enough blood in your system, the only cure is a stem cell transplant. And I
mm,
knew that that would be sort of the road that I needed to go down, but I put it off for many years, high productive years with family, with working and everything. I was feeling okay, but I wasn't feeling great. 7 years ago, my health crashed and I had really no other choice but having a
mm,
stem cell transplant. It'll be 7 years in June. I'm here to talk about it and very grateful. I had great doctors, a great hospital with lots of experience, but I put it off for a long time and I had
mm,
my head buried in the sand basically
mm,
for those earlier years going on this health journey. So I'm
mm,
here today with sort of this, you know, how all the things that I learned on this health journey, plus my experience as a healthcare executive, how can I help others with a health journey, with communicating better with doctors, caring about your health, being very focused that you have to be the one in charge of
mm,
your own health. And I call it being the CEO of your own health.
mm,
And
mm,
so, really, about 3 years ago, I started doing more research and some writing on the subject. Whether you have a complicated health journey or whether you just need preventive care, or whether you just need to follow protocols that will give you a healthier life and improve your opportunities for a long lifespan,
mm,
what should people be thinking about and do? Because the bottom line is they don't teach this in high school, in college. You work for an employer provides you health insurance. They don't really teach you about accessing care and having
mhm,
agency and being able to communicate with doctors. So employers don't teach you that. Your insurance company doesn't teach you that. And your doctors don't have enough time. If you're lucky, you have 15, 20 minutes with a doctor,
mhm,
right?
mhm.
So, what do you need to know? And I sort of figure it out because of my own healthcare journey, but I did a lot of research on the topic. And in fact, there are healthcare researchers since the 1970s and 80s that have been studying this issue. What makes for better health outcomes?
Right.
What it's not just modern medicine, which clearly, I'm a product of modern medicine being here to talk to you today,
Mhm,
but what gives patients the knowledge, the skills, the agency, the confidence, and the courage to do the things that they want to, that they really need to do for their health
mhm,
and really optimize their health care outcomes. And these studies showed that patients who are engaged in their care have better health outcomes. And
mm,
when I read that, probably about 3, 4 years ago, I said, I was in the healthcare field. I've seen many doctors. How come nobody said to me, when you're engaged in your care, you have better health outcomes? This should be the first, like, introductory
Right.
101 that doctors should share with patients, that they should put posters on the wall. People who are engaged in their care have better health outcomes. And if there's one thing that people should walk away from this discussion today, is knowing that. And it's not
Hmm.
just about standing up for yourself and being an advocate. It's a negative connotation to that. If you go in with knowledge, skills, and you've been sort of have the practice, and you have, again, that courage, because it's very hard to do these things, particularly if you are going through a healthcare journey,
Hmm.
particularly if someone in your family has had a bad experience with the healthcare system or doctors. No, because there's going to be this underlying, like, frustration and fear and anxiety. So how do you adjust in a way you're thinking, and call
Hmm.
it, growth mindset? How do you have this mindset to say, I want to learn the things that I need to learn, and not just when a healthcare crisis comes,
Right.
because nobody's going to the bookstore or Amazon to buy a book. Who's going to give me the skills that I need to have to go to that doctor's appointment?
Mm.
It's few and far between to get this kind of exposure to what it takes to be, and I call it, because it's sort of the name of my consulting company, the thinking patient. Because
Hmm.
that's the piece that's missing. You have your humanity, you have your voice. Not everybody knows how to use their voice in the
Right.
medical environment. You may have gone through hard times, you're a good problem solver, you have all these skills, but do you really know how to make the best use of medical services, accessing services, communicating with doctors, following up on your own care, seeing patterns, monitoring your own care, knowing
Mm.
the names of your own medication and how to properly take them? All these things are so important. And I just felt like, even me being in the healthcare system, I was not focused on any of that. And that's why I said I didn't know what it was like to be a patient, because I was sort of too busy thinking about reimbursement issues and access to care. And did we have enough supply? And how were we going to communicate different things to people? But it wasn't about the
Right.
patient and the physician relationship.
Yeah, I can see that. And I feel like even with that patient-physician relationship, it's like a hierarchy. Mm, Accepted modus operandi is that the physician knows best and
Mm,
that you follow his instructions. And
mhm.
so I think that causes a lot of people to not know how to use their voice, not know the right questions, because he's been had years and years of education and study. He knows all the scientific terms, and it feels intimidating on the one hand, and on the other hand, he is the one that has all the knowledge and the know-how. And so I think that can be a barrier to advocacy and agency because, and then when you go into a facility when it's filled with people or they have a very busy practice and you only get 15 or 20 minutes of his time, you really just don't have that in your mind unless you've written it all down, all the questions you have. And oftentimes people are just like, hey, I have enough on my plate. I can't think about this. I'm gonna just let the doctor handle it until it's a crisis point. So I think even with that being said, there's so many barriers to even being your own advocate because we have been programmed and conditioned to believe that the doctor knows best and not to ask questions and just follow what he says and take this medicine without regard to, well, how do I feel? What is my body telling me? What questions do I need to ask in order to feel more empowered in this dynamic?
I mean, you raise so many good issues. There are a lot of barriers and prior experience, or the overwhelm that sets
Mhm.
in. But think of it this way, too, that your care will be better when the doctor understands, like, what you're thinking about and what you understand. So if you
Mhm.
don't speak up, if you don't ask for clarification, if you don't ask for
Mhm.
more information, the doctor just assumes that you understand everything. So
Yeah.
it's part of the dialogue that needs to happen. The doctors want to hear you speak because they want to
Mhm.
know what you know from what you don't know. So, what needs to
Mm.
be clarified further? But the patient needs to take that initiative. It's
Yeah.
very important because the doctors are under a lot of pressure, also, time pressure, complication pressure, the pressure of electronic medical records and having to get
Yes.
everything in there and make sure it's right because there's so much risk and liability and there's a lot
Mm.
of data in that system. So the doctors have a lot to contend with too. But think about it, and I've had some really wonderful doctors, and particularly in my area, hematology oncology, that I have one of the best doctors in the country who was responsible for my transplant and my care and still is. And she sometimes still misses things. And if I didn't
Mm.
speak up, if I don't speak up, or if I don't say, well, what's in this medication you gave me? Because doesn't I'm taking 15 different medications, and isn't there a duplicate with this medication and that medication? She goes, oh, you're
Mm.
right. Stop taking this and do that. The cardiologist prescribed these medications. Are they contraindicated by any of the medications that I currently take? Try to, the best of your ability, coordinate all that information and keep bringing it up. I see probably 10 different specialists because transplants affect every organ and part of your body. I see a
Mm.
cardiologist, a dermatologist, a pulmonologist. I see all these doctors. And if I have a question, something's bothering me, I will ask every single doctor that I go to. I will say, from the last time I saw you, these issues came up. It may not be their specialty, but I'm telling you that I have gotten information from different specialties about the hematology oncology part because everybody sees different things. So you have to be the one to bring this up to your doctor to be able to say, you're the one who has to direct, doctor, the last time you said that I was going to get, you know, a bone marrow biopsy. That was 3 months ago. I saw you 3 months ago. You said, I'm going to get that. Oh, yes, I'm glad you brought that up, but I think we're going to wait another 3 months. So the doctor
Mm.
knows, look, you're on top of your own care and you really want to understand. And sometimes what the doctor is telling you verbally. So the doctor needs to know like what your best learning style is too.
Mm.
It's very
Mhm.
overwhelming. Sometimes people invite other people to come with them into the room, a friend, a family member to help take notes and remember everything or even ask questions because sometimes hearing the words isn't enough. So you say to the doctor, can you repeat that? But do you have like a chart or a picture that you
Right.
can show me? I really want to understand. I'm more of a visual person. Can you please
Mm. Mhm.
show me that? Or can you please direct me to, a disease specific website where I could learn more information about that? You want to use the doctor's time very judiciously, but you want to get recommendations from the doctor of how to learn. Look, I want to learn
Mhm.
more about my blood cancer disorder. Where else can I go? Who can I learn from? And I
Mhm.
was fortunate very early on in my diagnosis. This research foundation had just started. It was like maybe just a few years. And the person who started it and was advocating for a lot of more research in this area was also a patient of this
Oh,
disease.
okay.
So it
Okay.
was
Mm.
patient focused, but it was researcher focused because, again, there was no cure and really no good treatment but a stem cell transplant. So
Sure.
I hooked up with this organization very early on and gave me so much comfort and support and learning tools. And unfortunately, I found it by myself, but unfortunately, I had to find it by myself
Mm.
20 years
Mhm.
ago because doctors also don't have the time to say, okay, this is how you should learn about your disease. I have
Right.
found over the course of my many illnesses that doctors won't necessarily, unless you ask, doctors won't necessarily say to you, if you want to learn more, you could go here, here, and here. However,
Mhm.
we are so fortunate in this day and age that we have not only the internet, now we have AI to help
Yeah.
us explore and research. During my health journey, I also somebody told me about Google Scholar. Google Scholar is
Mhm.
that you get all the academic references, so you actually get the actual original evidence-based research that is done in that specialty. So there's
Right.
so much available. And if you're really overwhelmed by doing all that on your own, find that disease specific, patient focused or research focused website. And most common diseases have
Yeah.
that. And even the diseases that are the undiagnosed, kind of hard to diagnose, orphan diseases or rare diseases have their own website. And these are all places not just to learn, but get support, get comfort, feel like you're not alone in this. Because Modern medicine is what's keeping many of us alive, and I'm
Right.
very thankful for it. I want to now learn as much as I can to keep myself as healthy as possible and also
Hmm.
share that information with other people as well.
I do know that Google Scholar is there, and there are so many resources now. AI, you mentioned AI, asking it to use sources like Google Scholar to give you information, to disseminate that information is so important. But with that being said, what are some of the basic steps for a person who has either an illness or they're just having to go to the doctor on an annual basis, but not really knowing to ask more questions or not really having that extra information to make a decision or even to be able to catch earlier, like the type of illness you had. So, what are some of the first steps a person should take when they're ready to be their own advocate and to be empowered when it comes to their health?
Right. And I call it being an engaged patient, being
Hmm.
engaged. And
Or
we're really, I
engaged.
say we're all patients because everyone needs a doctor. The first thing is you need to have some type of primary care, family medicine, internal medicine, who is your primary doctor who's going to help you think out things, set up a standard routine for how you're going to be evaluated according to all the scientific information that's available from all the medical societies that it will give you, will guide the process for monitoring how are you doing as you're aging, as you're going through different
Mm,
stages in your life, and having a relationship with somebody that you trust, that listens to you, pays attention to what you're saying, and helps you develop your own voice. So I think that's really important. It's not so easy in certain areas of the country because there are not as many primary care physicians. In that category is also geriatricians. These are doctors who specialize in people like over 60 or 65 years old. And about 5 or 6 years ago, I started seeing a geriatrician, and that has been really a wonderful, wonderful experience. I mean, he's a great doctor, but more than being a great doctor and really caring about the older population, it's about they study and are trained to understand the aging process and how
mm,
different diseases it manifests differently depending on how old you are, how medications affect people at different stages in their life, recognizing different things and helping you plan for a healthier life. So anybody, and these are even rarer, geriatricians are even more rare than
mm,
finding a primary care physician. So finding that doctor you could have a relationship with, trust, is very
mm,
important. So when you start, whether it's a relationship with a doctor that you've been seeing or a doctor that you need to that you see for the first time, what no, regardless, the first thing I tell everybody to do is prepare for that visit, prepare for that appointment, prepare in advance. I guess I was good at it all the time anyway, because I have a very project management kind of mindset
mm,
because of the work that
mm,
I used to do. But it's like you start with really, what do I want to accomplish? What are my priorities? Oh, what do I really want to know about? What are my questions? What things have happened, what other tests I've had, what my medical history has been, maybe research you've done on symptoms, and put that all in one place and write that down. And you write it
mm,
down so you remember it better. You write it down so you don't forget to ask the questions. You don't forget to bring it up. Because the appointment is only 15, 20 minutes, you want to not forget. Time can go by pretty quickly because the doctors have their own process. It's called the medical interview of what they need to do during that 20 minutes. And they always
mm,
will, how are you and how you've been feeling and what's the reason you're here? You need to have a response to that pretty quickly, concisely, and then really give them a background of your any medical history. But really, what are you there? What are your priorities? What are you concerned about? What do you really need to know? And that shows the doctor that you're ready and willing to work in partnership with the doctor on your health. That's a very big first step. The second step would be really when you're listening to the doctor through this interaction, really understanding the language of your health, the language of your disease, the language of your medications, knowing that and really working on it. I mean, for a person like me who's on so many medications, and every appointment, there's somebody in the room asking you, well, let's review your medications. You need to move that along pretty quickly, and you need to be able to talk about it because they go over to make sure to assess medications and how you've been feeling and in your interactions, and you need to have that language. If you're experiencing pain, what are you experiencing? I experienced personally before my transplant, I was feeling like this bone pain and I couldn't describe it. All I could say was bone pain. And then during my research, a few years ago, I found that there's like 72 words you can use to describe your pain. Researchers up at McGill University in Canada came up with this methodology. Nobody ever shared that with me. I found it
Of
in my
course not.
research. So I was able to then describe, and I share this with people in my workshops that I speak to people about how to express themselves. And people with pain, look, there are a lot of people walking around with types of bone pain, orthopedic pain, migraines, or
Mhm.
some random pain or some continuing pain. You keep a journal and you keep that record. So when you go to the doctor, you could be very specific when you feel pain, what you're feeling, what have you been doing to trigger that pain, how long does it last, what times of day does it happen. You keep a
Mm,
journal like that, you go into the doctor, it gives the doctor a more concise framework for what you've been experiencing. Like you're focused on, look, I want to get better. This is what I've been experiencing. So I call that like the language of your health. And then the third
hmm.
part is, developing your questions, to always have questions in your back pocket. And I say write them down, but there's so much available through AI. It's like, okay, I'm seeing a dermatologist for the first time for an annual examination, a whole body check. What questions should I be asking my dermatologist? People just go
Mm,
in to do whatever, and because they want to, they don't like, no one likes seeing doctors, so they want to run
right.
out of there. You have your list of questions that very easily found on the internet, or just the basic questions when you've been diagnosed and you want to know what are the risks and benefits of each treatment, or what
Hmm.
if we just waited and watched and saw what happened? What else should I know about? What other treatments are available? All these questions, these sort of generic questions that are
Right.
applicable across diseases. If you're pre-diabetic, your glucose levels are high, let's have that discussion. But sometimes you have to initiate that discussion where the doctor says, okay, we did a regular glucose panel and you're a little bit high and we'll just watch it and
Mm,
see. Well, okay, doctor, but what can I do before that, my next appointment,
right.
to pay attention to that? And there's lots of options. And I experienced that because some of my medications caused my glucose to spike. I never had
Mm,
any of these issues before, but they came because of the trajectory of my disease. But I learned
right.
so much about how proactive you can be in saying, what else could I be doing? What else should
Hmm.
I be asking? So these are important things. So that's the question asking part is important. And also, as I mentioned before, I can't say this enough. When you ask the doctor questions, the doctor's able to discern what you know from what you don't know, and they know you're interested. And it's also a way for you to just check, even if you think you know an answer, sometimes it's sort of complex and you think you know the answer. If you haven't discussed
Hmm.
this with your doctor, you should be asking that question just to check, to validate your understanding.
Yeah.
It's
Yeah.
really important to do that. And then there's the time you're spending with the doctor. That time has to be participatory. I always put a notebook on my lap so I could make little notes through the appointment. Doctor tells me something, I write it down so then I
Hmm.
can refocus with the doctor. The doctor says something, okay, I don't understand. Can you explain it in a different
Mm,
way, please? Or what else can I be doing? Or what other sources can I go to? So, and that participation, react and interact with the doctor. And when you prepare in advance and you have questions and you've done sort of that study, it lets you be present and focused in the room with the doctor. And it is overwhelming and you have a lot of anxiety, and I still do. I mean, I'm much better at it clearly
sure.
because I have a more sort of evidence-based approach to seeing a doctor. It's important to use that time wisely. It's like people spend a lot of time buying a new car or leasing a new car. Oh, what kind of car do I want? And making a
Hmm.
spreadsheet of all the dealers and all the cars and how much and what, extras and what else I want to do. And they spend all that time learning about all the different cars. It's the same exact thing about learning about your health and your body. It's just there's so much more fear and anxiety associated
Right.
with, I personally never wanted to be sick. I was in the healthcare system because, for many reasons, one, my father was in the field and he introduced me to the field just generally. But I had a lot of, grandmas and grandpas and aunts and uncles who were sick and cousins who were sick. I never wanted to be sick. And,
Mm-hmm.
my worst fear came true when I got sick, but I fought it. My
Yeah.
interest was to not just survive, but then
Mm-hmm.
like feel good. And when I
Mm-hmm.
realized that, oh God, I'm really feeling better, I want to share this with other people because I think that my focus and my energy and my desire to participate in my care has helped my health and has helped my longevity as well. And so then the
Absolutely.
last piece of this framework that I've been describing is I call it really courage.
Mm,
And now I add like mindset, but having the courage to know you can learn new things no matter how
mm,
old. If things are important to you, you can learn new things and you learn this. Like you're not born with any of this knowledge. You have to
right.
learn it, right? And so little, even the littlest, smallest steps, do a quick outline before you see your doctor. You will see it will make a big difference in the
Mm,
conversation you will have with the doctor, and the doctor will be very sort of enthusiastic and impressed because most people don't do this. And I'm
yeah.
trying to get the word out there that everybody should do this, but most people don't do this. They don't prepare in advance. They don't think, what else could I be doing? And when you take these small steps, they add up and it gives you more
Mm,
confidence and it gives you more courage and it just builds and builds and builds till you get to a point where I may not be right on everything, but I know how to research. I know how to ask questions. I know how to find these things out. And it really gives you such a feeling of like, I have this agency and I can help
mm,
myself be better and I can work with my doctors. And if I don't like my doctor, I'll find another one. Like, if this doesn't work, let me learn from this. What have I learned
mhm,
from this? And I'll apply it to the next time and what else I could be doing. I think there's just so much information available. And yes, people have full working lives and children and family and managing a lot. If you don't take care of your own health, then
mm,
you're not going to optimize your ability to live like a quality of life kind of existence. And I think
exactly.
that's really important. And all the things that you talk about having agency and being in this sort of life's bliss and creating it for yourself, this is a
Mm.
very big part of creating it for yourself.
I agree 100, 1,000%, because your health is so important. I know that so many women who have been caught up in their careers, caught up in relationships or parenting, they do often neglect their health. Not as important in their minds, especially if you have children, as getting the children to the doctor. I was thinking about the stages from babyhood all the way up to maybe teenage, 18 or whatever, where you're supposed to meet these different milestones and how mothers are so consumed with that and it's been pumped into their head so much that they forget about themselves and their own health. And I think like, what if there was those milestones didn't end at 18, but they kept going in terms of our own health. As we get older, we know we have these milestones, we have these things we should look out for, we have these things that, this is what it looks like to be healthy, how you should feel, foods and whatever it is, having that same kind of charting and readily available information for us as we get older. Because I don't know why they assume that we just know, but we don't. Because, like you said, that they don't teach us. The healthcare and school, they don't teach you, and insurance companies, they do not teach you these things. I think that would be very fantastic. And then the other thing while you were talking was there's electronic medical records, and we get access to my chart and all those things. And wouldn't it be great to be able to jot down our own questions and notes in my chart so that when we do have our visits, it's there and the doctor can see it, the nurse practitioner can see it. And so I think that can kind of ease some anxiety because everything leaves your head when you go to the appointment and stuff like that. So I think that, absolutely have your own notebook, have your own journal. But if that were a feature, I think a lot of things would drastically improve.
Yeah, I love that idea. Also, I always share with people feel like, oh, I have this big list, but there's not enough time to get to everything I have to ask.
Hmm.
And I tell people to ask the doctor how best to contact them in between appointments. because most doctors will respond in some way and they
Mhm.
all have their individual methods. So this is something that physician practices or hospitals like don't dictate. So if a physician wants to give out their cell phone number, my hematologist oncologist gave me her cell phone. She says, I don't care, I'm on vacation, whatever, just you text me.
Mhm.
Text, I'll be here for you. Other doctors say, send me a message through the portal. Other
Right.
doctors say, call the office. The office will give me a message and I will call you back within a day or two. So it's
Mhm.
important to write that down also, every doctor that you
Mm.
see, to ask them, how can I contact you in between
Sure.
appointments? And then they get to know that you're following up on things
Mhm.
and you're interested in finding out about your health and taking care of yourself. And they know in the long term that will be better for them too, because
Mhm.
they'll have better results. And it's also like more satisfying for doctors to know that they're really supporting people in helping take care of themselves, because there's so much that relates to health outcomes related to patients' own compliance and
Right.
adherence to medication regimens, or not smoking, drinking,
Mhm.
doing drugs, all those things. So the more a doctor can help a patient sort of deal with what are the things that behaviorally or strategy wise that a patient could be doing, it will be more satisfying for doctors professionally too, because that's the whole reason that most of them have decided to be doctors and work with
Right.
patients, and particularly in the primary care area.
Mhm.
And I think cardiology, and a lot of, I found that in pulmonology too, and dermatology, because they really want to help people to also help themselves.
Yeah, absolutely. Well, this has been so great. You share some really valuable information. And I think the last question I have is, with all the things that you've shared with us, and I think we've kind of talk this throughout the entire conversation. It's like the mindset, shifting mindsets of people who feel disempowered, feel powerless when it comes to their own health care. Like, what are good ways to even shift that mindset to let them know you actually have the power over your health and in partnership with the providers?
I think that's a tough thing to do overnight. There's not like one thing, but it is a practice.
Hmm.
So the more you practice being brave, do the little things, and they will build on each other. And you'd be surprised how many people don't ask doctors certain questions that might be helpful to them, and the doctor wouldn't even know that that might be a question on your mind. So I tell
Hmm.
people the most important question to ask is the one you're most afraid of asking. So be brave and ask that question that you're afraid to ask. Am I doing something wrong?
Yeah.
What's the prognosis for my disease?
Mm.
What else could I be doing? Because nobody wants to really do more or do something
Mm.
so complicated, right? But if you keep practicing being brave, like it does get easier. It gets
Mm.
easier. So that would be, find ways to, if you're brave in other parts of your life, or if you're not,
Hmm.
find ways to be brave in this medical setting, because you're doing it for yourself. It's the best reason in the world to be brave.
And it's the ultimate form of self-care, self-devotion as well. So, Dana, thank you so much for sharing your experiences, your wisdom, what you've learned over the years through your own medical journey. But where can people find you? What do you like offer? I know you do consulting, but what else do you offer and how can people get in contact with you?
So I post regularly on LinkedIn, and I research and write on subjects that are related to patient engagement and physician-patient communication. Every week I'll put something new, things that are on my mind, new things that come up. My website is thethinkingpatient.com, and that's for a business to business kind of, for consulting, for speaking, workshops, and the resources that I offer to help organizations and communities share this important information with their constituents, their members, their patients, to raise that level of awareness that certain practices and strategies really will help people have better health outcomes.
All the information will be in the description box below. So be sure to connect with Dana on LinkedIn, her website, so that you can learn more about how to be a better advocate for yourself as a patient, an engaged patient, not just for bad times or when you're in health crisis, but even in the so-called normal, regular annual physicals and checkups that you get, because you never know what could pop up. So be engaged, be an advocate, and take back your agency when it comes to your health and every other part of your life so that you can definitely have a life where you're thriving and not just surviving because you actually deserve it. So thank you again, Dana. Thank you for being here. And thank you all for listening and for your questions and comments. Leave them below. And also be sure to like, subscribe, and share this episode with someone who you know who needs it. Until next time, take care and be well.